decision. Is it true that the doctor had said if you waited a week more that you could have died?
I could have died. I had 2 potential fatal infections. One of the infections were pending sepsis, and both my grandparents died from sepsis. I had a foreign object inside of me, which was a 10-inch Penrose drain, and that they found in the middle of my stomach. And they told me that the infection was from an unsanitary medical equipment and unsanitary room.
So what would you say to those of us that want to, have something done, we don't want to pay full price? Mm-hmm. What's your message to us?
I always tell everybody, just please do your research. I always recommend that you do it in the U.S. I post my videos on YouTube so people could see what happened to me, just so that way it doesn't happen to them and that they can learn from my experience.
And you are well today? You are happy with your body?
I am happy, and I think that I have angels watching over me because I'm still here with my family. I could have been dead, but I'm still here.
Thank you, Melanie. Thank you. We are glad too. Dr. Gravani, do you see many patients like Melanie, stories that they went to other countries to get it done cheaper?
Yes, this is a very important show because safety is so important, and you do not want to bargain shop for your plastic surgeon. This is your body you're talking about. It's a sacred temple. I mean, you do not want to risk it by going to someone who's not certified by the American Board of Plastic Surgery. Being certified by the American Board of Plastic Surgery is like a car having wheels. It's the basics. Beyond that, then you want to see how stylistic and aesthetic and how the work of that surgeon is as an artist. So you're always a physician first and a plastic surgeon and an artist of the body second. When you're going to another country like Colombia or South America, not that they may not have qualified plastic surgeons, but you don't know who's doing what on you. There's no laws, there's no regulations on it, and you have to leave that country to come back with all the possible risks. And they're
germs, even just traveling back home.
Yes.
Right?
I mean, I have a lot of people coming from Saudi Arabia, from outside of the country to visit me. I have princesses and foreign dignitaries, but they come and stay for about a week or 2 or longer until they know that they're finalized with their healing. And I have them go to recovery hotels where they have nurses. Mm-hmm. There's a right way to do things and a wrong way. You do not want to bargain shop for your body.
Mm-hmm. Thank you. Thank you. Who has questions? Yes, ma'am. Nice color on you.
Thank you. This question is for Vanity. I wanted to know, when they did your butt procedures, did they shape it in any way, or do they just put it in there, or is there anything you can do, like lay down on your butt, or does it just stay like that?
When they inject it in, they just inject it into, the different spots that they map it out on your butt, and after that, you're supposed to massage it to get it shaped round. But the problem with that is it's a substance that's not supposed to be in you. So when you're, moving it around, it's going into different areas, right? So if a doctor has to go in and cut that out, he's got to cut here, 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 here. You know what I'm saying? It's just not...
Wait, Dr. Gravani, can you jump in about the butt thing? Do you do any of those injections?
Definitely not. The only thing that belongs injected into the buttock is fat, because the buttock already has fat. So you're putting fat where there's already fat. So the body accepts it, and it's from your own body. And the key is that for her procedure to remove all that, she's probably going to need a large incision to remove it, and then the skin's going to be loose, so she's going to need a buttock lift, so she's going to need her skin actually lifted upward. So it's a fairly complex surgery, but I've done it before, and a lot of people are getting these bargain injections. They don't know what it is, and I've seen people with horrible complications that we have to do a 2 or 3 stage operation to reconstruct and rebuild them back to normal.
Wow, wow. Yes, sir.
Prior to the surgeries, I mean, was there a deal of low self-esteem involved, in the sense where, like, did someone ever tell you that you weren't good enough? Or, I mean, I'm just wondering, are you satisfied now that you've all had the surgeries? I know my sister in the middle, she's stated her case, but you both are satisfied.
Yeah, well, for me, I definitely had low self-esteem, I lost all of this weight. I wanted to look good. I wanted to look satisfied. And all I saw when I looked in the mirror was somebody with all this flab and droopy breasts. I wanted the whole outcome. If I lost the weight, I wanted to look perfect. And that's what I was going for. It was nobody telling me, oh, I don't look good. It was just for me, for myself, in order to feel better.
Well, you do look good, honey.
Thank you.
You do. Up next, how would you like to trade your muffin top for a better booty? Well, there's a procedure that can make that happen. We are talking about the hottest trends in plastic surgery when we come back.